Services, Topeka, Washburn Law Clinic. What's up, Washburn? Kansas Legal Services, wonderful. DVAC. Okay, you listen, for the folks that are putting in acronyms, you know I don't know what that means. What is DVAC? Hi, Dennis.
DVAC is one of the victim service providers, I
Okay,
believe, in
wonderful.
there we go. Yeah, Domestic Violence Association of
Wonderful.
Topeka.
Okay, excellent, excellent. Okay, who else do we have in the room? Building Health Inc. Okay, wonderful. Okay, great. Yeah, yeah. So we're across Kansas
Mhm.
and it's such a pleasure to be with you on today. I'm gonna go ahead and start sharing my presentation and get into it. If you have questions, please be sure to put those in the chat, and our wonderful host from Kansas Legal Services will be able to say, "Hey, Chanel, someone is saying something," so that we can go from there. And so, as I share my screen, Rhea, if you could just kind of wave your hand and let me know when you see it, that would be great.
Absolutely. We do see it.
Okay, excellent, excellent, excellent. All right. So, I will be talking about sinking child welfare, homelessness, and foster care. And so, I know I mentioned an acronym earlier. Let me explain what sinking means. Sinking means simplifying your navigation and confusion in child welfare because our system can be very complicated and very complex, and we need to do a better job of making sure that families, staff, and volunteers understand how to navigate the foster care system and child welfare because this is involving families. And so it's extremely important. And so I don't know about you, but I have a why. And I am just assuming that if you are working in this work, you have a why as well. And I'm going to share my why orally. And if you would like, please put your why in the chat. I do this work because of my own family history, because I believe that that family is important. And three out of the four of my grandparents were actually raised by someone else. And when I think about family and when it goes really well, and then when it doesn't go well, how do we make sure that we're still standing in the gap and that we're still providing what families need so that they can make the best of their lives? And so I'm a Midwesterner, so from a military family, born in Nebraska, raised in Oklahoma, and then moved to Kansas for law school. And when I came to law school, I at Washburn, shout out to Washburn. I had no idea what area I wanted to practice in, but then when I began taking classes and began really digging deep, I looked at my own family history and said, I want to work with families, and I want to work with families in some of the most complex situations that families can experience. And a lot of folks were like, that is insane. Why would you want to do that? But that's where I am, and that's what I love, and that's what I do. And so I took a lot of classes in Washburn. I was a GAL, a student GAL at Washburn at the law clinic, and ultimately opened up my own law practice and began practicing and representing families in the child welfare system. What I saw is that this is a very complex, difficult system to navigate. And so I went to the judges and I said, hey, I want to create a course where parents, when they have their child removed, they can have like an orientation class on how to navigate the social and the legal systems well. And the judges said, great, create it. And so it took a few months. I worked with a social worker, and created a class, and it was called Sync 101, CINC, because that's what the code in Kansas is called. And so I taught that for 5 years and provided hope, help, and humor for parents who were navigating the system. It's why I can talk to anyone in front of anyone, because when you're used to like every month coming into a room and people are really angry at you, but you know that the information that you have is going to really help them, you're able to persevere and push through. And that's what happened. Parents left the class like, oh my gosh, I had no idea. And they presented as angry, but they were really afraid, right? Really afraid of the unknown and what was expected of them and how to navigate this very complex system. And I had the same experience when I was practicing. I thought that if I could just be a really great attorney in the courtroom for my clients, then that was enough. But I realized that I needed to understand the systems that my families were navigating. And so I did that. Then I left the courtroom and I was appointed as the regional director at the Department for Children and Families. So I got into social services, which is more than just child welfare and more than just foster care. And I realized that there was a whole other system that I needed to understand and grapple with. And so that has led me to the work. I've kind of come back to the work that I do regarding families. And I just always like to say and mention that faith is really the string that connects my entire life. That I believe that you can have resources, but if you don't have that support, if you don't have that um, innate like belief that you can do this, that you can move forward, then at times things are lacking. And so we all have our why, and we, especially who work in this space, have to like consistently remember our why because it's not easy work, and at times it's not work that you get lots of thank yous. And so you have to know why you do it, and you have to know why you show up every day. And so I want to talk about the agenda on today and what I plan on talking about, and that is why you should care, like why you should care about foster care and homelessness or houselessness, shared sorrow and success. I'm going to explain just very briefly the foster care system and process. And then I want to talk about current programs that connect foster care with houselessness and addressing that issue and the next steps. How do we actually connect on a level that makes sense? And so that's what we're going to do today. So this is some data, and what I'll say is that the data surrounding houselessness and foster care, it's not super prevalent, but there are some data points out there that I want to highlight. On the screen, you see houselessness and incarceration because these are, I believe, can be intertwined and interconnected. And so for a youth who is of the age of 17, they have reported houselessness at any time in their life 20%. So 20% of the time they're reporting houselessness. Age 19, it's 21% have reported houselessness in the previous 2 years. So these are folks that have been involved in the foster care system. And then age 21, 25% have reported houselessness in the previous 2 years. And so you look at that and you're like, oh, 20, 21, 25, right? That's the foster care population. Of the general population, ages 16 to 26, it's only 4% of youth. And so what we see is that children who are involved in foster care, that they're experiencing houselessness, homelessness at a higher rate. And so then we have incarceration, which again, it's interconnected. And what we see, age 17, 30% have reported incarceration at any point in their life. Age 19, 17% have reported it within the last 2 years. And then age 21, 16% have reported incarceration in the previous 2 years. And that's comparing the lifetime incarceration rate for the general population, which is 6.6%. And so if a youth is involved in foster care, it's highly likely that they have touched the criminal legal system at some point in their youth. And so that's why we should care. We should care because, and we should care because of the numbers, but on a deeper level, we should care because of humanity, of the fact that it matters what happens to our young people who grow into adults. And when we have rampant houselessness and rampant incarceration, that doesn't bode well for communities. And so when we think about shared successes and shared sorrows, it matters what happens to people. And, sometimes people, oh, that's not me. I don't have anything to do with that. It impacts you. It impacts your community. It impacts what happens around you. And then just thinking very big picture of the promise, right, that we've had regarding the Declaration of Independence. So we're celebrating 250 years, and one of the signature lines in the Declaration of Independence is life, liberty, and the pursuit of happiness. And I talk about this when I do different trainings and I have different curriculum, but I talk about life and what that means. And for me, life is like the ability to have a home, like to be in a place that's safe and that's secure and having access to that. And liberty is to be free, like to be free to make mistakes as well and to be able to rebound. And then the life, liberty, and the pursuit of happiness. The pursuit of happiness is not the guarantee of happiness, but it's being able to pursue it. And let me tell you something, if your basic needs aren't met, it's hard, right? It's hard to see past where you are. And so it matters because we need to make sure that the basic needs are met in our society, in our community, so that we can move forward. So, the way that I do this and the way that I talk about this is, I started 2014 when I was in the courtroom and I was having that orientation class. But when I got to the agency, I saw how our systems don't work well together and how even the way that it's structured, even the way that it's set up, it's very much we have mandated reporters and they make a report. And then essentially what we've been telling mandated reporters is, when in doubt, report, and then your job is done. As if people who are mandated reporters don't have relationships with people. And so what I have is a connection vision board, and I do this exercise with agencies and with organizations who need to connect with other entities, but they're not really sure where to start. And so what this board is it's the idea that there are many different systems that are involved in child welfare, which is why I was so excited to share with you today when Joy asked me to come on, because when we think about houselessness, that's economic needs. And economic needs are it's housing, it's transportation, it's employment, it's all the things that we say don't like move a family into the foster care system, kind of, but it's all the reasons why families don't reintegrate with one another. If a family doesn't have stable housing, if a family doesn't have, if there aren't resources, if there isn't a job, if there isn't, suitable transportation, then reintegration can't happen, or it's slowed down considerably. But the truth is that there are so many barriers that can happen regarding housing and regarding transportation and regarding employment. And so these are the things that we have to really dig into and understand that folks that work in social services, for example, have to connect well with folks who are meeting the economic needs of our community so that economic needs understands the barriers that social services are experiencing, understands the barriers that families are experiencing, understands the barriers that courts are experiencing when they put things on like a reintegration plan or whatever the case may be, understand how health at times can be involved in that. And so, and then, right, the folks who are making the laws, government, how they need to be in the room and have these conversations and connections as well. And so the exercise that I do is the Connection Vision Board. And we tell a story of a family who's navigating the foster and child welfare system and how all the systems interact. And I actually started this, so I have this video that I show, and then organizations, they literally put vision, they put it on the board, and then they have a workbook and they begin thinking through who do I need to connect with more? And so that's the question that I have for you today. When you think about when you think about the work that you do, oftentimes we have frustrations, and our frustrations is connected with like someone's missing, or I'm getting the runaround, or my questions aren't being answered, or I don't know who to ask, right? And so you think about the work that you do, just think about what families are experiencing. It happens in so many different ways, and it happens consistently. And so we have to do a better job. I was at a training the other day. It was a child welfare training and mandated reporter, and they were talking about all the things. And then for 5 seconds, she said, and child welfare needs to connect better with other organizations and entities and systems. And that was it. So that's great, but how, right? How, when, why, where, how, like we have to dig deeper. And so that's what this does. And so what I always like to do is just give like a snapshot of the child welfare system. And oftentimes it can feel very overwhelming, but there is a process and there is a reason why things happen. And so I want to go through that with you on today as we then navigate into what are the resources that are available in Kansas regarding housing and foster care. So we know that. Um, the government makes the law. And so before, there's a couple different ways that I could kind of talk about this, but one of the ways that I'll say is that it is a constitutional right to be a parent. Troxel lays that out very clearly that the government can't just come in and take people's children, that it's a constitutional right. And so there has to be due process, there has to be a process that families go through if the state says that there are, reasonable efforts need to be made, and there are concerns regarding safety regarding a family. So we have that piece that there's this right that happens, but then we have CAPTA, a 1974 law that really modernized the family and child welfare system as we know it today. When I think about like my grandparents' experiences, there was no system, and there was no system that they could really be a part of, because even the fragmented system that there existed regarding like a family aid, they couldn't really access that because of the color of their skin. And so the 1974 law said, okay, states have to have a formalized way to receive reports of abuse and neglect. And if you have this, then you'll begin to receive federal funding. And so that's 1974. Every state now has a way to receive allegations of abuse and neglect. And so the interesting thing, though, is that every state makes their own laws about what constitutes abuse and neglect. And there is federal definitions, but it gets very state specific in concern of what is considered, SINC, a child in need of care case. Like, for instance, truancy, so being habitually absent from school, is not a sink case in certain states. When you also think about mandated reporters, like for instance, Oklahoma, everyone's a mandated reporter. Okay, that's what the law says. But in Kansas, there are specific people and organizations and entities, if you're a part of, that are considered mandated reporters. And so it is very state specific, but ultimately, typically it starts with someone has called the hotline, and or there's a visit from the police, or in Missouri, you can have a medical hold. And so there's a way that basically it's ignited. So you can't just necessarily see someone on the street and say, you're going into foster care. It doesn't work like that. So there's a process. And so after a call is made, then the agency receives the report, and they have to then decide, is this going to be screened in or is this going to be screened out? And an example of that is uh, if someone calls and says, I am really upset that this family feeds their child a balanced meal every day, that does not seem right to me. They should be able to have snacks and all that. Like, that's going to be screened out. Okay. But if someone calls and they say, hey, there's this 2-month-old and they have bruises, right? The agency's going to be out the same day. And so there's different response times. Um, uh, same day, there's a 72 hour, and then there's a 7 day. And so there's different response times that the agency has to go out and to assess what's happening with the family. And so they make contact with the family. They have to make contact with the family. They have to see the child. And they can say, okay, the report came in and it said that these children have bruises up and down their body. They see the children, there are no bruises. And they talk to the family and they say, okay, this is a contentious divorce. Maybe there's a parent who's abusing the hotline, because that happens too. And so nothing is going to happen. So that can be one way, that can be one path. And so it stops, the case is done. There can be situations where the worker comes out and they say, okay, what the report said is not what I found, but I do think that this family could benefit from some type of services. And so that's where we get into preventative services. And preventative services can look like, parents as teachers. It can look like I'm going to refer you to some local food pantries. It can look like Family Preservation Services, where an agency that we're contracted with is going to come in once a week for X amount of time and really work with your family on some different things. And so there's many different kind of ways and paths that it can take. So you get creative, you talk to the family, you figure out what the needs are and what they aren't. And sometimes the family wants these services and sometimes they don't. Let's take the position that a worker comes out, they see that there are issues, there's domestic violence in the home, there's abuse that's happening, the children have disclosed it, they offer the family preventative services, the family says no, there's some concerns about safety, and some imminent risks that exist. Maybe there's sexual abuse, and the person lives in the home with the child, has access to the child. So at this point, the worker can say, "Okay, I'm gonna, refer this to the district attorney's office, or maybe the police get involved." Either way, it comes to the court, and the court ultimately has to make a decision as to whether they are going to um, as to what the next steps need to be. And so you have court involvement, and court involvement can happen in many different ways, many different paths. But let's now say that the family is involved in court, and they're involved in court. And although this doesn't always have to happen, the children are removed. I've been in cases where the children aren't removed, but there is still court involvement. But let's say that the children are removed. So they're removed from the home. And now we have to decide what's happening with this family. So, disposition, adjudication. So, what's going to happen and what's going to be the plan for this family? And so, most cases, most families are offered a reunification plan. That's most families. Some families aren't, and there are some different reasons for that. And so, what the data shows us, though, is about 50% of families actually reintegrate and reunify with their family, with their children. And so for the other 50%, there's other pathways that are taken. So there can be permanent custodianship, there can be adoption that can happen. There can be sole family, or a child can age out of the system. So those are the pathways. But what I tell families is that what's so important about this is that a resolution is going to be achieved. And because of some federal law, it has to happen within a certain amount of time. And so that's the family and child welfare system. And so housing can be involved in many different ways regarding a family. Maybe they were referred because of, and the law actually says that like poverty can't be a reason that families get referred. But I'll tell you what, there aren't a whole lot of rich people that are involved in the child welfare system. Okay. And so when we think about the challenges, can you just put in the chat whether you have heard of this or not, if you've heard of a technical versus an adaptive challenge? So yes or no. So yes, you've heard of it. No, you have not heard of it. Can you put that in the chat for me? I want to make sure folks are with me. Hmm. Yep. So we have yeah, I have lots of yeses, lots of nos. So it's a mixed bag. This was developed by Ronald Heifetz. And I like to explain it like this. You are building a house and you see that your house does not have a door. And so you say, I'm gonna hire someone to go buy a door. And you hire someone and they go and they buy a door. And then you say, all right, I need someone to put on this door. And so then this person puts on the door. And then you say, I want it red. And so you tell the person, hey, can you please paint this door red? And they paint the door red. And so you step back and you look at this house. Your house now has a red door, right? That's a technical problem. The problem is known, the solution is known, the responsibility is with the person who can put on the door, who has the resources to put on the door, and the obstacles are resource limited. So the only way that you're not going to have a door is if you don't have the money to get a door, okay? An adaptive challenge is different. An adaptive challenge is a challenge where you are new to an organization and they don't trust you. Right? You're new to an organization, they don't trust you. And so whenever you have an idea or whenever you're trying to engage, there's this undercurrent of pushback. There's this folks aren't really bought in, and you can't really put your finger on it. And so that's an adaptive challenge. And so, what that says is that the problem is often unknown, it's hard to identify. The solution may be unknown, it requires some learning. The responsibility is really with those affected by the challenge, and the obstacles are less tangible. So, it's hearts and minds and values and loyalties and relationships. And so, when I think about just my own career and experience, um, I think about how when I have worked with with the courts or with the social service agencies, I've experienced both of these things. We think, oh, well, if that's the problem, just this is the solution. But oftentimes there's something else that's happening. It can be low trust. Um, so many different things. And so a technical challenge versus an adaptive challenge, it's really important that we identify what's actually happening. And when we think about houselessness and when we think about child welfare, we think, oh, well, there are some resources. Why is it that youth who are involved in foster care are experiencing that? All they have to do is tap into the resources, but it's often deeper than that, and there's many different issues that exist within youth who have experienced foster care and what it means to have to basically tap into resources from an agency that they may be tired of dealing with. All right. So technical versus adaptive challenges. And so, what I want to navigate to right now is I want to navigate into what's actually happening in the landscape of connecting child welfare and houselessness. And one of the things that's happening is the foster youth to independence, and it's tenant protection vouchers. And so, this actually came to be, believe it was like 2019. And so, it is vouchers to for specific HUD housing that's dedicated to support youth who have experienced the foster care system. And we have it here in Kansas, and I can specifically talk about what counties are currently involved in it. But I wanted to play for you the impact and how youth are actually experiencing it and how that shows up. And so, Joy, if you can just give me a thumbs up once you hear it, that would be great.
Hi guys, my name is Demetrius Cooper and I'm going to talk about FYI. For those who don't know what FYI is, it stands for Foster Youth to Independence Initiative. And it's run through the U.S. Department of Housing, HUD funding, and with the help of people like Secretary Carson and former foster kid Chris Patterson, this program is set into motion, and what they do is they find housing for foster kids when they get out the system, because so many kids don't have anywhere to go when they get out the system. I was in foster care from the ages of 3 to 18. But because I didn't have a family or any real consistent person in my life during that time, when I got out the system, I didn't have anywhere to go. I was sleeping with friends, couch hopping, sleeping outside, sleeping at work, just kind of making things go, kind of surviving as I did. So it was such a blessing at the beginning of this year to start working with this program. Not only did they give me housing, like, it's so much bigger than that to me. I have my first home. This is the first place I'm comfortable in. And I feel like it's home. I can look at it and say it's home. And much more than that, I'm given opportunities to grow now. Like, now that I have my own stable place to stay, I'm learning, one, how to maintain my apartment, because none of that stuff was taught to me, but also just more responsibility just comes with this. And I can't be more grateful for this opportunity. So guys, thank you so much. Thank you.
My name is Tysican Hall. I'm a youth experiencing homelessness, but through the Nevada Partnership for Homeless Youth Transitional Housing Program, I am now working towards self-sufficiency. I was born in Atlanta, Georgia, and then my mother decided that she wanted to move to Las Vegas, and then we became homeless in March of 2018 because we were evicted very suddenly. It was like 8 in the morning and they didn't give us a warning at all. They just told us that we had to leave. So we ended up spending that night in an airport. I made the decision to leave because I couldn't do it anymore. And so now I'm in NPHY's transitional housing program. It's weird having that sense of freedom that I never really had before. Now I feel like I can grow into my own shoes. When you enter a transitional housing program, you have to, or NPH-wise, you have to make a case plan. So you have to be in school or you have to work part-time or full-time. You have to save your money because we want you to exit into self-sufficiency. My dream career is to be a music artist because I do love to sing and write my own songs, and to be able to use that platform to further advocate for not just homeless youth, but every other issue that homeless youth happens to intersect with.
So a great program that again is fairly new through the federal government that existed, and so that exists, and so we have it available currently in Wichita, Sedgwick County, Harvey, excluding Newton, and Butler counties. We also have it in the city limits of Pittsburgh, Allen, Bourbon, Cherokee, Crawford, Labette, Lynn, Montgomery, Neosho, Wilson, and Woodson counties in southeast Kansas. It's also available in Johnson County and Shawnee County and other areas that have a housing voucher for this population, but it's not specifically tied to foster youth to independence is Kansas City, Kansas, and Douglas County. And so it's happening, and Kansas is taking advantage of this federal program for our youth. And so that's really important. The next thing that I want to highlight is another federal program, which is, well, so this is independent living self-sufficiency program. So this is through, it has like a subsidy, so a living subsidy that exists. What I'll say, and then there's Chafee funds. So Chafee funds are federal funds that exist, and there are some resources that can be used for housing surrounding that. What I'll say though is that what is really important is for if you know of a youth who has been involved in the foster care system, it's going to be really important for them to reach out to the Department for Children and Families because they're the ones who have to determine eligibility. They're the ones who can give access to specifically like the independent living program and the Chafee funds. And so they can help be a navigator for youth who otherwise wouldn't have access to some of these resources. And so the other piece that I want to highlight that's happening is here in Kansas. At the beginning of the year, I was looking just at the news and I saw this pop up. And so this is a state partnership. So before we're talking about like federal, state, now this is a state entity partnering with an organization, a local organization, the Kansas Housing Resources Corporation. And so what I saw and what I'm sharing with you is an announcement that there would be $10 million for a housing support program. And the deal with this is that it's not necessarily run out of the foster care side of things, but it is a grant that will assist low-income Kansans at risk of or currently experiencing homelessness. So it is looking at prevention, it's looking at families who are experiencing this. And I'll tell you what, this has been a missing piece in the work that we do. Oftentimes, housing is such an issue and a barrier, and it can be hard when you can give like a family food assistance, but it's like they need housing. And so that this partnership is happening is amazing. So this will happen. It starts July 1st, and it looks like it'll kind of start in October, and $5 million for 2 years, and then with an option of an additional 1 year option to renew. And so it's an example of partnership, and it's an example of a way that a state agency who typically has access to these resources can partner with local organizations doing the work. Okay, excellent. I will add that to the list. Ms. Monroe said that McPherson County has it also. And what I will highlight is that the information that I got specifically about the foster youth to independence was through independent living, a division at DCF. And they wanted me to tell you that if you ever want them to come and talk, they absolutely will. And so I will make sure that you all have their specific information because they have all the technicalities in their brain and it can be very technical and concern of who can have access to what. And so I'm happy to hear that there's another county in Kansas that has it as well. So this is something that we're watching, that we're paying attention to, just in concern of how it actually impacts families. And it looks like it's going to be ran through TANF, so temporary assistance for needy families. And so that's also known as like cash assistance and things like that. And so that's exciting to see and to know that that's happening. The other piece that I want to highlight is local action regarding houselessness. And uh, probably in 2014, there was a mayor here in Kansas City, Kansas, Wyandotte County, and Mayor Holland. And he said, I want to impact and address youth homelessness in our community. And he made this decree, he said it, and what happened is organizations heard about it organizations heard about it and began doing something about it. And so it was through what's called Impact KCK or Kansas, and it was founded in 2015. And it's the idea that families need access to many different resources. And what they did is they said, okay, we want to create a space where a family can just go to one place and they can get their needs met. And they worked through the schools. They worked through Wyandotte County Public Schools and the federal McKinney-Vento Act, which requires all public school districts to collect and report data on students identified as homeless under the act. And so then these students were referred to Avenue of Life and the Impact KCK program. And so they would have days, they call it Impact Wednesdays, where families could go to this one space and they could have their housing needs addressed, employment, income, food, childcare, education, adult education, healthcare, coverage, life skills, family relations, mobility, community involvement, social impact, parent, like legal, mental health, all say all these things in one place. And they didn't have to tell their story 50 million times to various organizations. It could be in one place in one space. And so they did that. And what happened was they have reached over nearly 3,000 families. They have housed 778 families, and they have employed 673 families. And so it works, and it's important, and it's impactful. And it started with the mayor saying, this is what we want to do, and a local organization kind of picking up that torch and saying, what can we do within our space, and then how can we make an actual impact? And they have really made an impact within the community. And so that's Impact KCK. And so what I will say as I get off of this, stop sharing. Let me see. What I will say is that it's not just one thing. It needs to be like all the things, right? It's how do we address this? Well, we have to like start talking. We have to get in the same room. We have to understand what are the barriers that our families are experiencing. How can we reduce that? And how can we make sure that we're being honest about what families need? One of the systems that I talk about is the heart resilience. So I talk about heart resilience because it's often the system that we don't like, we know it, but we don't name it. And even within the FYI program, Foster Youth to Independence, there is a part of the program where they work with the social service agencies to like support youth in like the soft skills. So you can get something, but how do you keep something, right? How do you take care of your house? How do you make sure that you have what you need? And so heart resilience is the idea that something can happen that can be hard, that can break your heart, but when you are around people who love you, who support you, and who want the best for you, then it can be repaired again. And so we all need that. Like we all need that thing, that person. And oftentimes I know that that's what's missing in our systems, that we don't name that and we don't like kind of rise it, elevate it to the level that it needs to be. And so when we think about the work that you all do regarding economic needs, and how it relates to social services, how it relates to the government, how it relates to someone's maybe court case and law enforcement and health needs. Like it's all it's all connected. And so the other question that you know, I'll leave with you. Can you see my screen? I thought I was sharing. I don't think that I was sharing. All right, that's okay. The other question that I'll leave with you though is how are you connecting with these systems? Like, how are you intentionally working with these different entities so that we can better serve our clients and our communities? And so, it's not just we need to connect with them, it's developing a plan to connect with our systems. Because if we don't, then we'll be in our silos and we'll say, it's so complicated, it's so difficult. And that's all that we say about it. And then we expect for families to figure it out on their own. And so I'm going to pause and just see if there are any questions or comments that the room has.
Absolutely. There we go. I'll let you take it over, Matt.
Me?
Yeah.
Okay. Hi, Chanel. This is great. I love your passion and your knowledge. Your slides are very helpful, and I assume those will be shared with us. I'm going to be the skunk in the garden party here and raise a topic that I think needs to be fundamentally realigned, and that is the system that we have right now in place in Kansas for the attorneys who are hired to represent the children and their parents in the sync dockets is left to the discretion of individual county administrators, court administrators, politicians. And we have seen firsthand that those decisions are made very often without regard to competence or expertise. Those decisions are made based on who will do it the cheapest, the quickest. And there are many, many, many examples where we have asked to compete for these contracts, KLS, and we have, of course, a track record and a pedigree, and I mean, we are the leaders in this space in the courtrooms, and we don't get considered because, well, you can you can surmise the reasons why we weren't considered. For example, we didn't have relationships with the judges and the court administrators. And so I know other states have dispensed with the local rule on hiring attorneys to go into the sync court. I know Colorado has. I think Wyoming or Montana has. I've been on panels where they've talked about that. And I think until the state is prepared to kick the beehive and recognize that the system of local hiring needs to be changed, there's still going to continue to be fundamental flaws with how Kansas respects children at risk. And I mean, I could talk about this for 30 minutes. We have guardian ad litem's attorneys who never make home visits.
Mm-hmm.
We have guardian ad litem's who won't make home visits because, in part, they aren't reimbursed for the time or the expenses.
Mm-hmm.
My law partner next door to me, Mark Haggerty, drove to Parsons to make a home visit for a GAL as a GAL, and all that time was not reimbursed. There was expenses. Now in the scheme of things, it wasn't much. But I will tell you that other states like Montana, they not only require home visits, but they pay expenses no matter where the GAL, no matter where the child is. So they'll fly them to Virginia. There was a case that they described where they flew the GAL to Virginia to make a home visit. Zoom and Google Meet is not an acceptable substitute for actually being in the home and seeing firsthand what's going on there.
Hmm.
So I think you've done a good job of summarizing a lot of the changes and progress we've made. But ultimately, if the people that go to court who are there as a guardian ad litem um, for a 5-year-old or a 10-year-old isn't showing best practice, everything else can be failing. And so I took more time than I wanted to, but I will just tell you firsthand, I've been here 4 years, and we have approached county courts about getting on the sync docket, and we're told no. And I
Hmm.
can assure you it wasn't because of our expertise. It was because we were not going to do it at $30 an hour.
Right. Right.
So
Funding.
I think, yeah. So the skunk has just left the garden party.
Well, Matt, I mean, you're naming several things. Like the you're naming the fact that at times there are people who are making very important decisions and they have the danger of just hearing one story. And it's why when we have these different meetings or when like KLS has when I was at DCF, I was like, okay, we need to engage our government. Like we need to engage our legislators. And so what can we share with them that they don't know? Right. And so we would begin having meetings and inviting them to a space where we're sharing information, but we also want for them to share information with us. And so it was about, hey, this is the data about what's happening within your community. And these are some of our recommendations on how we can actually address it. You've also named relationships, you've named economic needs, budgets, very real issues that at times governments and city governments have. But then you've also named like how we even value the people who are doing this work and the funding that it requires. I remember, so sometimes it can be so frustrating when you're in like this middle space, and that's what I felt like I was in when I was at DCF. And I found out that some of our workers were on food assistance. Like people who worked for the state were on food assistance. And I just feel like that says something about that says something. And not only were they on food assistance, I also found out that lots of people had two, three different jobs. And so when we think about how we value through compensation the people who are doing the work, and this is also connected with our attorneys, because right, when I was a guardian ad litem, I think it was $60 an hour reimbursed, 65 or whatnot. But when you think about what other attorneys make and what other attorneys can make in this space, it's glaring. And so I said, okay, I can't change it, but what I can do is I can tell the story. So we created work groups, and I asked for them to share their story. I wanted to understand what are they sacrificing by doing this public service and working at the state. And so we compiled those because all I could do is I could share it with my boss, who could share it with her boss, who could eventually share it with the governor. And so we did that, and that happened. And within a year, we began having pay raises. And what they did is they began looking at other states and saying, okay, how does Kansas compare? How are we compensating our workforce compared to, the surrounding states? And we were behind. And so there were raises that happened over the next few years. And I'm really proud of that work. It wasn't just what we did, but what we were able to do is just provide the stories so that we could see really the human impact of what it takes and what families need. I see a hand. Am I calling
That's
on
my
people or
hand.
okay?
I didn't know if you were calling on people, but I
I don't
didn't
know.
want to
Yes.
interrupt.
Hi. Go
Um,
ahead.
thanks. Um, I'm also going to enter the garden as a skunk. I recently attended a CLE with one of my colleagues, and they were talking about um, the worst thing that could happen to a child. And the absolute worst thing, what they said, was the death of a parent. And the second worst thing that could happen to them is being taken away from a parent. And it didn't say a bad parent, like an alcoholic parent, a mean parent. Just getting taken from a parent is the second worst thing that can happen to a child. And I am a new attorney about to be a guardian ad litem in two cases for Douglas County. And that is hard to think about our system traumatizing children by removal. But also leaves me kind of stuck because I definitely can't overhaul the entire child in need of care code and system that we've already built. Um, but yeah, that was pretty shocking to me. And of course, it makes sense. Removing a
Yeah.
child from their parent is traumatizing. Um, so.
Okay, so that's like a totally different CLE. But let me just say this. I know it's interconnected. I talked about like what the process is. What I'll tell you is that Kansas has gone through a fundamental shift in how we even talk or think about child welfare. That before it was when in doubt, report, remove, remove, remove. We need to err on the side of caution. That pendulum has shifted. And it shifted because what we understand is that number one, the families who typically get removed are families of color. Like they have a higher likelihood that they're going to be reported and that their children are going to be removed from their care. And then it's harder for them to reintegrate. And so it matters when we remove a child, even if it's for a moment, like even if we're removing, just for a moment, just to do an investigation. And so what has happened within, and I can say this within DCF, is there has been extensive training on understanding the impact of removal and understanding the importance of prevention and support. So how can we do everything within our power to make sure that families stay connected? And one of the things that I know that the agency did when I was there was called team decision-making meetings. So when I was practicing, and congratulations to you for stepping into this world. It's important work, Katie. I would be in court and I would have a parent come up to me or a grandparent come up to me and say, I didn't know that my child was going to be removed. They told me, they came to my door, they asked would I accept services. I said no, and now I'm here in court. And so there was like this missing conversation that didn't happen with families. And so what team decision making meeting, what that does is that says if an agency is considering separating a child from a family, then there has to be a meeting that has to happen with the family, with the parent, and if the child is old enough, with the child, and the family can bring their support system as well. And so the magic that happens in that meeting, not that it always results in not a removal, but what happens is that solutions are came up with that the agency couldn't have come up with and that the family couldn't have come up with. But people begin thinking about, okay, what can we do differently? How can we help support this family? How can we support this child? And when we first introduced it to the courts, they were very hesitant, but then they began seeing the impact of it, and it works and it helps. And so it has to be things like that. The other thing I read a law journal article about the four questions, and it's asking these questions before removal. Can we remove the danger instead of the child? Can someone come and live with the child? Can we remove a person and have someone else come live with the child? So what are the questions that we need to ask? And so we had these judges, it's called Four Questions, Seven Judges. They came into Kansas and they had this conversation with like 100 folks, and we really grabbed a hold of that thing. And every county began implementing it in a very different way. But it's like some of these very simple solutions can really like pause us, right? We don't want to be quick to remove kids. It needs to be intentional. It needs to be methodical. It needs to be for a reason. It needs to be governed by the law. Because there are times when the danger is at a place where we do need to remove a child, but it can't be, I just felt it in my gut. Like that's not a legal reason. There has to be an articulable reason, and it has to be governed by what the statute says. What else?
It's a great discussion. Yeah, are there any more questions? There's been a couple of comments in the chat. It's a great article if you want to go view that. Any more questions?
I'll just make a comment. I feel like we could talk about this subject for another hour and a half.
Absolutely.
But I appreciate the knowledge. I appreciate that there's somebody that's working on this. And I've had clients have gotten their children back going through the program. I have a client that's used the program you talked about earlier where they age out of foster care. So I know it can work, but it is a lot of hard work and it takes a lot of different components to put it together and people working towards the same goal. So thank you for what you're doing.
Yeah, thank you. And what I hope that everyone got from this is just like igniting your desire to connect with different systems, igniting your desire to ask more questions and and have different resources, have, lunch meetings, make different connections with court administrators, right? Begin collecting stories and telling the story because change often happens very incrementally, but it can happen, and we know that. And so thank you all so much for your time and I'm sure when they send out the slides, it'll have my contact information. And so if you're looking for a workshop or someone who just talks all things child welfare, reach out.
Yes, thank you so much, Chanel. It was a great presentation, and it was super valuable. So we usually will get the recording up on our website within a week. You can also revisit any of our other webinars on our website as well. And then you can find all the past webinars. And then as well on our YouTube. That's where all of our past videos will be as well. If you do need her contact, just let us know and reach out and we'll give it to you. But thank you all for being here. And thank you again, Chanel. That was very, very a great presentation.
All right. Well, thank you all. Take care.
Thank you.